Hello, everyone. Welcome back. I'm glad to have you here. In this session, we will discuss gastrointestinal and hepatic geriatric clinical care. Before we begin, let's go over what we discussed in the last topic. Previously, we discussed the atypical presentations of endocrine and metabolic disorders in geriatrics, including functional and cognitive change, identified geriatric-specific risks in diabetes management, and recognized hypoglycemia and hyperglycemia in older adults. And finally, we discussed the atypical endocrine disorders and preventing metabolic decline using geriatric reasoning. By the end of this session, the learner will be able to 1. Describe normal age-related anatomical and physiological changes in the gastrointestinal tract and liver. 2. Explain reduced gastrointestinal motility and reduced hepatic reserve, including implications for drug metabolism. Let's start by exploring the changes that occur in the gastrointestinal tract and liver with aging. Normal aging produces gradual but clinically meaningful changes in gastrointestinal and hepatic structure and function. Oesophageal motility slows, increasing the risk of dysphagia and aspiration. Gastric emptying becomes delayed, contributing to early satiety and reduced intake. The intestinal absorption efficiency declines, particularly for micronutrients such as iron, calcium, and vitamin B12. Alterations in gut microbiota further affect digestion, immunity, and medication metabolism. The liver also undergoes predictable aging changes. Liver mass and hepatic blood flow decline, reducing the delivery of drugs and toxins for metabolism. Enzyme activity decreases, impairing first-pass metabolism. These changes are physiological, not pathological, but they significantly reduce tolerance to illness and medications. Also know that digestion still occurs, but it is slower and less efficient. This reduces safety margins and increases vulnerability to illness, malnutrition, and drug toxicity. Let's proceed to see why gastrointestinal motility and hepatic reserve are reduced. Reserve refers to the ability of the gastrointestinal tract and liver to adapt during stress, such as illness, fasting, dehydration, or medication changes. In older adults, this adaptive capacity is markedly reduced. Even short periods of poor intake or mild illness can overwhelm digestive and metabolic capacity. Reduced hepatic reserve means medications may accumulate, increasing toxicity. Tolerance to fasting is diminished, making older adults vulnerable during hospitalization or acute illness. Small stressors can therefore trigger significant gastrointestinal or hepatic decompensation unless anticipated early. To summarize this session, I would like you to remember that aging causes gradual changes in the gastrointestinal tract and liver that slow digestion, reduce nutrient absorption, drug metabolism, and decrease reserve, making older adults more vulnerable to illness, malnutrition, and medication toxicity. That's it for this session. Thank you for watching. See you in the next session.